Autoimmune diseases occur due to an overactive immune system attacking the body's own tissues. Normally, the immune system produces antibodies that only target toxic and invasive substances. With an autoimmune disease, the blueprints to manufacture the antibodies get corrupted, and the antibodies can target the body's tissues and organs. In 1904, Donathensteiner hemolytic anemia was the first autoimmune disease to be recognized. In the 1940s, anti-nuclear antibodies and the rheumatoid factors were discovered as diagnostic features of several other autoimmune disorders. After being infected with COVID-19, people have a much higher risk of getting an autoimmune disorder. Several factors can cause an autoimmune disease, including medications, genetics, and infections. Certain medications can induce alterations in your body and mess with your immune system. Autoimmune diseases can also be hereditary, meaning they're more prevalent in families with a history of such conditions. Genetic factors can also increase the likelihood of developing an autoimmune disorder. There are also many risky behaviors and factors that can lead to an increased likelihood of having an autoimmune disease. These behaviors include smoking or working in proximity to toxins. Biological factors include being born female, with 78% of people with an autoimmune disease being female. Another factor is obesity.
Symptoms of autoimmune diseases vary depending on the specific type and affected areas. In addition to the ones featured here, there are also skin manifestations such as redness and rashes, digestive disturbances, or abdominal discomfort, enlarged lymph nodes. Diagnosis of autoimmune diseases often requires multiple tests and can be a lengthy process. Symptoms of autoimmune diseases can mimic those of other conditions, leading to delays in diagnosis that might last for months or years. Initial diagnostic steps typically involve a thorough medical history review and symptoms assessment by the doctor. There are two common tests for autoimmune diseases: blood tests and image tests. Blood tests are commonly employed to detect autoantibodies, which are antibodies that target the body's own tissues. Image tests such as ultrasounds, X-rays, and MRIs may be utilized to visualize and assess potential damage associated with autoimmune diseases, particularly in joints and internal organs. There isn't a cure for autoimmune diseases. Various treatments can help manage symptoms and control immune system's response. These treatments include methods such as taking immune suppressant medications. It works by suppressing the immune system, which helps prevent inflammation and cell damage in the patient. Symptoms management, which means taking medication or doing physical therapy that reduce the symptoms of the autoimmune disease. Lifestyle changes. The patient should try eating an alternative diet and reduce stress.
There are many different medications that can be prescribed for people with autoimmune diseases. The main categories are corticosteroids, targeted immunosuppressive drugs, and anti-inflammatory drugs. These types of medications all target different parts of the immune system with various different side effects. Additional medications to manage symptoms include painkillers, antidepressants, insulin shots, sleep aids, and creams for rashes. Other more invasive treatments include plasma exchanges and intravenous immune globulin. Some supplements may address deficiencies caused by autoimmune diseases, such as insulin or vitamin B12. In addition to medications, lifestyle adjustments have a crucial role in treatment. Exercise and physical therapy are recommended for muscle-affecting autoimmune diseases like myositis and multiple sclerosis. Quitting smoking is also advised for autoimmune diseases, especially those that affect blood vessels. Many autoimmune disease patients report a lower quality of life, which can be caused by many factors like dwindling long-term support or lack of understanding from family and friends, losing one's sense of self, or lack of desire or inability to participate in certain activities. All of these can lead to low self-esteem, sadness, and even depression.
Autoimmune diseases affect nearly 50 million people in the United States, making the third most common disease category after cancer and heart disease. What's more surprising is that 80% of those with chronic autoimmune conditions are women. Currently, researchers are studying why women are more likely to develop these diseases. Race and ethnicity also play a significant role in autoimmune diseases. For instance, Black patients have about 10 times higher odds of being diagnosed with autoimmune hepatitis compared to white patients. Latino patients have a 25 times higher risk. Furthermore, African American and Hispanic women are more likely to develop lupus. Support from patient advocacy organizations can be a game changer for those with autoimmune diseases. Here are some few key organizations. The Autoimmune Association promotes research and awareness for autoimmune diseases. The National Alopecia Areata Foundation provides state and regional support groups. The Immune Deficiency Foundation shares people's stories with policymakers in order to raise awareness. Megan O'Rourke, a writer with the Hashimoto thyroiditis, experienced intense fatigue, brain fog, flu-like symptoms, rashes, and pain. Despite this, doctors misdiagnosed her for years, leading to isolation and decline in her quality of life. It wasn't until she figured out the right combination of lifestyle changes that her condition finally improved.
Over the last few years, researchers in Germany have been testing the potential of CAR T therapy for autoimmune treatment, a cutting-edge treatment in which a patient's immune T cells are genetically modified to better attack disease cells. Patients with lupus and other diseases showed symptom reduction after CAR T infusion with promising long-term results. This heralds a potential breakthrough in autoimmune treatment. In January 2024, a team of international researchers presented evidence that could explain why autoimmune disease patients are predominantly women. A molecule called Exist, only found in women, is linked to many autoimmune diseases. Exist inactivates one of the two X chromosomes in women, but in the process can also generate molecular complexities linked to many autoimmune diseases. Although there is no cure for most autoimmune diseases, breakthroughs in the last few decades have prolonged the lives of many people. This graphic illustrates that medical advancement for autoimmune diseases is happening at breakneck speed. Making knowledge readily accessible, as our website aims to do, is also a key factor in ensuring both patients and researchers can get the understanding they need. Advancing technology is making new therapies and treatments possible, like the previously discussed CAR T therapy or new nanotechnology treatments. Treatments like this were previously unheard of in the medical world, but thanks to our human ingenuity, we are treating diseases that were once thought to be untreatable. We hope our website might help at least a few patients or researchers get the vital information they need.